At no time during this pandemic have there been more people in the intensive care units of the province than right now in this third wave. Joining us to share their experience a year and counting into this crisis, both in Ontario's capital city, Dr. Michael Warner, Medical Director of Critical Care at Michael Garron Hospital and a member of the COVID-19 Provincial Critical Care Table. And Dr. Shelly Dev, Staff Intensive Care Physician in the Department of Critical Care Medicine at Sunnybrook Health Sciences Centre and an Assistant Professor in the Department of Medicine at the University of Toronto. Welcome to you both.
Thank you.
Thanks for having us.
Really excited to have you both on the show to talk about this. It's been a heavy week. So last week, you were among 153 ICU doctors across Ontario who sent a letter to Premier Doug Ford, Health Minister Christine Elliott, and Dr. David Williams, the province's Chief Medical Officer of Health. And here's what, in part, you wrote. If we continue to allow cases to grow exponentially, the ICU demand will outstrip supply of staff beds. Once overwhelmed, we could be forced to triage the critically ill, deciding who gets ICU care and a chance to survive and who receives palliative care and dies. As ICU doctors, we are the last line of defense, and we are ringing the alarm bell. Please hear it. We are imploring you to act now. Dr. Dev, let's start with you. Why was it important to add your name to that letter?
I think it actually echoes the distress and the worry of myself and all my colleagues in the world of critical care. And by colleagues, I mean doctors and nurses and respiratory therapists and the vast amounts of people who are involved in trying to respond to what's going on. And I think that beyond this being a political issue or political decision making, this is fundamentally based on the guiding principle of healthcare in Canada, which is we must do our best to take care of the sickest people. And we must all agree that in this time, what's required is absolute the most drastic decision making possible in the best interest of the most people. And nobody's better equipped to see that than people on the front lines.
Throughout this pandemic, Dr. Warner, we've been hearing this debate on who people should be listening to. Should they be listening to the politicians that they elected or to the public health officials who are on the front line of this thing? Why was it important for you to add your name to this letter?
Well, just to answer the first question or the first comment, I mean, the politicians are elected and they're the ones who have to make the ultimate decisions, and people who work in healthcare provide their input. The public health physicians at the same time are not on the same front lines that Dr. Dev and I are on. We're not public health experts, but we see who we're intubating. And we also have a very good idea of how finite the resources are that we're able to provide. And what we saw and what we were concerned about is being in a position where we cannot offer care to a patient that we can take care of today, where that patient will have to die, but today we could save them. And there's no more morally distressing situation than that for any healthcare worker. And it's a situation we haven't faced in this country, as far as I know. It's one that I still hope we can avoid, which is why writing that letter, at least that segment of that letter, was really important. And I think it helped lead to some action that was taken by the government recently.
And just to follow up on that, do you think that there is a disconnect between what doctors think should be happening and what the provincial government thinks should be happening?
Well, our line of sight is different. Dr. Dev and I, we work in the ICU. We see the sickest of the sick. We're both making a living. We don't have to think about businesses. At the same time, the message from doctors in general is to protect people because we don't want people to get sick and die. And life is a finite journey. And my view is that if the healthcare of people is protected, the economy will recover thereafter. But when you try and do both at the same time, when you're dealing with a virus that you have no control over, people will get sick and businesses will suffer. So I think that it's really important that we focus on healthcare, especially now in the third wave.
And Dr. Dev?
I agree with that, but I also feel that even though we're not part of those other industries that are suffering, we are seeing people who are having to be on the front lines and make a living and having to provide services that we all agree we all need, who are getting sick, whose families are getting sick. And if we don't take a longer view approach to recovery and we just respond to in the moment, concerns that are raised or by different members of the public, we will not see the end of this. And what we're arguing for is, yeah, really difficult things that people have to go through, really difficult moments of isolation that Dr. Warner and I, as human beings, are navigating as well. And I got to say, I hate it. I hate the experience of lockdown. I hate what my children are going through. I hate what my parents are going through and my in-laws. I hate it. But what I hate more is watching what is happening to people who are getting sick. It is so devastating, and I hate that more. And I think you can feel both things at the same time. That's what we're asking of people, because that latter part is so much worse.
And Dr. Warner, just to build on what Dr. Dev just said, I take public transit, and this morning when I was coming to work, I still saw people not practicing physical distancing or wearing masks. You're both, you see this every day. You're at the intersection of life and death every day. And I'm sure you've had to sign death certificates. What would you want the people who are watching this show or listening to us right now, what do you want them to know about this virus?
Well, unfortunately, I've signed 29 death certificates for COVID-19 since the beginning of wave one. And it's unfortunate that I had to keep track of that, but I thought it was important so I could kind of measure the impact of this based on my own practice. So I think that, there's individual responsibility, but there are so many people in this province who cannot minimize their exposure risk because of the work that they do. And these are the people that we truly rely on, the ones that we claim are essential, who have not been adequately protected. And even with the change in policy to provide vaccinations in a targeted way to people over the age of 18 in certain postal codes and in certain industries, it's still not enough to prevent the 30 to 50-year-old factory worker, rideshare driver, checkout clerk from ending up in my ICU with a breathing tube. Once the variant enters the household of these individuals who often live in congregate settings with multi-generational homes, it runs the table in the whole house, and somebody or many people get sick in that household. We need to protect those people. That has to be our focus, in addition to the lockdown measures.
And working in the ICU, I'm sure you've had to make hard decisions so far. Health Minister Christine Elliott recently said the government is trying to boost hospital capacity, but it has yet to prepare a cabinet order indemnifying ICU physicians from liability in making difficult triage decisions as to which patients will get the resources that we currently have. From your vantage point, Dr. Warner, how critical is it to get this cabinet order passed?
Well, there is an emergency standard of care that's been penned by the Critical Care Command Table and circulated to all the hospitals. Unfortunately, this was not debated in the public realm, and I think it should have been. And what it will allow us to do, if we're in a triage situation, is, depending on the level of triage, withhold life support. That means not put a new patient on a breathing machine after measuring their standard short-term mortality risk, basically the chance of them being alive 12 months from now. What it doesn't allow us to do, which would be outside the Healthcare Consent Act, is to take a patient currently on life support off that machine. But I think this presents a queuing issue and would really worsen my moral distress, because there are patients in every ICU in this province, I would say, for whom it's very unlikely they will survive their ICU stay. Yet the new patient, who could be 30, 40, 50 years old with COVID or some other disease, may not be able to receive care if we're in this triage situation, because new patients we may have to withhold care on, as opposed to withdrawing on incumbents.
And as a physician, Dr. Dev, I know when you went into this business was to help people. Finding yourself in that situation, that's a difficult decision to make, is it not?
Of course it is. It's heartbreaking. It's contrary to what you signed up for. What is one of the best things about our healthcare system in Canada, and that we're also proud of, is that we all agree that every person deserves to be taken care of. The sickest people deserve our attention first. It doesn't matter where you come from. It doesn't matter where you live, what your postal code is, your area code. If you come in and you're sick and you're the first one who comes in, you're the first one that we see. And when you have to factor in these decisions about who is more, according to a protocol, who is more, not to use the word worthy, but who is more appropriate to be put on life support, none of us really signed up for that kind of decision making, and it challenges the fundamental way of thinking when you get into medicine in Canada.
And Dr. Dev, earlier this week, Sick Kids announced that they were preparing an ICU unit to treat adults because of ICUs filling up in the GTA, which is very, it's mind-boggling that this is happening. And yesterday, Ontario physicians were urged to ration one of only 2 drugs known to reduce mortality in critically ill COVID patients due to a shortage. We're also hearing that the province has ordered hospitals to halt non-emergency surgeries as patients with COVID-19 fill ICUs. Dr. Dev, how concerned are you about the current situation that we find ourselves in?
I mean, I don't think we need to say anything new that we haven't already said. This is awful. This is brutal. What is heartening to me is that, my colleague physicians across the board are trying their best to help each other to make room for these patients. When you talk about sick kids, when you talk about patients that we've moved out of Toronto to areas like Peterborough and Kingston, where our colleagues are helping us do this, on one end, it just highlights the unbelievable sense of community amongst medical practitioners, which is what we deeply need. And on the other hand, it actually should demonstrate a reasonable amount of worry and fear. I have never been this terrified in the whole course of this. I'm sure Dr. Warner will agree that what we're seeing now is unlike what we saw earlier on. These are people, when you look at them, what you see is yourself. You see any person who you're next door neighbors with, that you're friends with, that are vulnerable. This is all of us. And where early on, we probably rested on our laurels a bit with these, with rationalizing around, well, it's older people or it's people with pre-existing conditions or what have you, to give give yourself a feeling of security. This is not that. This is anyone and anything I wish to tell anybody about what they could rely on as patterns to identify who is more likely to get sick. I so wish I could say something like that, and I can't. And that's what scares me.
Dr. Dev mentioned fear and being afraid. Dr. Warner, how are you feeling?
Well, it's been a long 14 months for everybody in healthcare. And I remember before wave 1 hit us, seeing what was happening in New York and Italy, and crying on the way during my drive to the hospital because I was so scared about what was going to happen. We didn't have vaccines. We didn't know how bad it would be. And wave 1 wasn't as bad as at least I expected. And wave 2 was bad, but we were prepared for it. Wave 3, the variants, this is a different disease. This is a different pandemic. And I am more fearful now than I ever have been in my life or in my career for what's coming. And I'm so worried about having to ration care and not being able to provide care for patients that we normally can. And I also am deeply concerned about the parallel epidemic of non-COVID related care being delayed and deferred. And it's very fortunate that we do have vaccines coming. And I think that provides me with a modicum of reassurance. But it's difficult to put into words how challenging the next 2 months, I hope it's only 2 months, will be for everyone in Ontario because of what they have to go through at home, and also for the people who are sick in the hospital and their families who are watching on Zoom.
Physician burnout is nothing new. Are you worried that this is going to have a huge impact on the people that we do need to carry us through this? I would like to ask you both. Dr. Warner, I'll start with you.
I rarely talk about myself in the media, but I'm completely burnt out. And I think just what everyone I work with is, it doesn't mean I won't be there. It doesn't mean I won't be working hard, especially the nurses, respiratory therapists, personal support workers, housekeepers, all the people who keep the critical care machine going. But this has had a huge impact on all of us because we live COVID at work, and then we live COVID when we leave work. It's 24/7 experience, and we see so much sadness and so much death. And because it's preventable, it hurts so much more. And I've shared some stories of patients in the media that I will never forget. And this has been a life-changing experience.
And Dr. Dev?
So physician burnout or healthcare worker burnout and mental health is one of my areas of expertise, and I've spoken extensively about it prior to the pandemic, where we weren't doing great prior to the pandemic. We had an epidemic of healthcare worker burnout. And what we need to understand in our healthcare system is that our healthcare system functions like a circuit, and any breakdown in that circuit will affect everybody behind it. And what is critical in our circuit is the health of the healthcare workers, because that is what is going to determine largely the quality of care any of us receive. So what you have is workers who are, just like Dr. Warner describes, he says he's not used to talking about himself. What that reveals is the thought process of the average healthcare worker. The headline you'll never see in the newspaper, that the average healthcare worker is just a good, decent person who really just wants to help people. And what they are most afraid of is being too tired or too exhausted or demoralized to the extent that they may make a mistake. They are not worried enough about their personal health. They're worried about how their personal health will manifest as a problem for their patients, for the public. And what we need to do, all of us as patients, is identify that connection between the health of the worker, our most valuable resource. We can have billions of ventilators, and if we don't have enough workers to take care of them and administer their uses, or same with medication, we will have nothing. And if we don't make the connection between how we all do as patients to healthcare workers, we are going to struggle and suffer. And I am so worried about my colleagues and my friends who I see every day just doing their best with diminishing personal returns in terms of their health. So it's something that we've been so lagging in terms of identifying how critical that is the health of the worker in connection to the health of the patient.
Just listening to you both speak, for me, first of all, I do appreciate, I know you say that you don't talk about yourselves, but I think it's really important for people to hear what you have to say, because there seems to be this kind of disconnect. I don't know if it's because you can't see COVID-19. I don't know if it's social media, but there's still a fair bit of skepticism towards reports that ICUs are hitting their capacity. Excuse me. For instance, I want to show you a tweet from columnist and former editor-in-chief of Sun News, Mark Toohey, and he tweeted this a couple of days ago. He writes, "One of these things," and this is in caps, "is not like the others. Hashtag COVID-19 death rate has never exceeded 0.6 per 100,000 residents in hashtag Ontario. It's been hovering around 0.1 per 100K since the beginning of March. No one," and that's in caps, "is in charge. ICUs are not full. The experts," in quotation marks, "are lying. Why are we in hashtag lockdown?" How would you respond to those who might feel like this is being overplayed? Dr. Dev, I'll start with you.
I do absolutely relate to that feeling of disconnect, because in our hospital at Sunnybrook, it's a very big hospital. There's a lot of intensive care units. And there are moments where, when I'm not looking after critically ill COVID patients, there is a part of my mind that can go off to, yeah, it's bad. It's bad. I get it that it's bad. And it's more of an intellectual check-in. It's less emotional. And when I go back into the COVID unit, it comes right at you as, this is terrifying. This is horrible. This is tragic. I absolutely understand this disconnect, because you ask yourself, can it really be this bad? And all I can say is that for those of us, on behalf of those of us who are there, or people who have lost people to this illness, is that yes, it's absolutely a real thing. What, I'll be frank with you, angers me so much about irresponsible reporting or tweeting by people who have a platform is to ask themselves, what on earth could the ulterior motive be to scare the public and to, raise the alarm on something that we're worried is the scourge of our modern times? What on earth could be the motivation to do this? It boggles my mind. It's absolutely repugnant to be that irresponsible. And I ask other people to ask themselves, when people have those lofty perches and say these things, what do they personally have to lose in comparison to the frontline grocery store worker or the factory worker or the person doing deliveries? Those are the vulnerable people. Those are the people we all need to be invested in protecting. Our teachers. When you say things like that from your perch of privilege, the word for me is repugnant.
And Dr. Warner?
Dr. Dev said it very well, but I told the public now that I'm burnt out, and a big part of that, is just the grinding that people give people like me in the media about the situation they're in. I mean, why would we lie? I mean, it's really bad. It's really terrible and imminently foreseeable. Like, we warned about it and nobody did anything, which is so frustrating. But for Mr. Toohey and lots of people, they don't have a mental model of what COVID-19 looks like. They know what dying from cancer looks like, or a heart attack, or a stroke, but nobody sees what we see. And maybe that's our responsibility and our fault that we haven't shared it. So that's one of the things I tried to change. And I pivoted. And I asked 2 families to allow me to share the stories of their loved one in public. And I think that helped turn the tide of public opinion about the mid-40-year-old woman who ended up dying on a heart-lung machine, an ECMO machine, after acquiring COVID-19 from her husband, who was a factory worker at a factory that was an outbreak. But he wasn't allowed to miss work because the outbreak wasn't on his shift. Or the young man in his early 30s, a non-essential worker who was forced to have FaceTime at the office because his boss wanted him there. And he shared an office with another young man who didn't wear his mask or adhere to public health measures, and he got the variant from him. And he spent a month in the ICU. Those are real stories, and that's what I see. So anyone tells you this isn't real doesn't walk in my shoes.
Sorry. Sorry. Very unprofessional of me, but it's really hard listening to your stories because those are all families that are impacted. And I know, Dr. Warner, I don't even know where you find the time to do all of this because you are juggling so many things, but I think you being on Twitter has helped people to, has helped to empower people. We've been talking a lot throughout this pandemic about COVID fatigue, about how people are tired of it and, you know, oh, another lockdown. This past week we had, you know, the stay-at-home order was announced. In your, from where you both are, what are your thoughts on the recent stay-at-home order? Do you think it should have come sooner? Dr. Dev, I'll start with you.
Yes, I do think it should have come sooner. I'm grateful that it's here. And I want to just reiterate the point of, you know, when people like Dr. Warner and I talk about these things and really advocate for these stay-at-home orders, we are also parents and partners and children of other people and dear friends of other people. And our lives are in total disarray and difficult at home. I know Dr. Warner and I both have our kids on the other side of our doors right now, homeschool. We are both trying to do this with the help of our partners. We are both worried about parents in our lives. I will say personally, loved family member who's going to have delay in essential surgical treatment because of this. And it's like I said, I hate the experience of this. I have found it so personally difficult. I have struggled with my own anxiety in the middle of it, as have my children. And still, I cannot bear to watch these people coming in and their families decimated by what is happening when we don't make the difficult decision to lock down, to distance, to mask. The fact that it is difficult and so hard for all of us doesn't mean that it isn't also the right thing to do.
And Dr. Warner?
You know, I speak very directly. It definitely came too late. And it wouldn't have been enough if we just had to stay at home. I was reassured by the pivot in the vaccination strategy to target the essential workers and high-risk postal codes. But again, that won't be enough. I mean, the Premier has made paid sick leave a political issue, which it isn't. It's true that once you get COVID, you can get 2 weeks off. But what about my factory worker, the husband of my patient, who didn't want to go to work, but he lives paycheck to paycheck? And if his boss says, you got to come to work, he's going to go to work. He's not going to take a day off to get tested. Even if vaccines were available to him, he wouldn't get paid to take that day off to get vaccinated. And that's just not right. And we have to acknowledge that that is not humane. And until that changes, until we have workplace inspections, rapid tests in congruent work settings, truly redefine what is essential during this once-in-a-lifetime experience, those same people will not receive the adequate protection, and they'll still be coming to our ICUs.
And when we talk about humanity, I'm sure you entered this profession, like I mentioned before, to help people. After this past year and the things that you have seen on the front lines, would you recommend someone who is thinking about going into this profession to go into this profession? Dr. Dev?
I often say to my trainees that medicine is really, really difficult. That you don't get told that, how personally painful the experience can be as a human being. And a lot of times you go into medicine not having experienced a lot of essential moments in your life, like birth and death and chronic illness. It's hard. It's super hard. But it is also quite amazing. And to be able to say that your job is about helping people, being present with people as they endure really difficult moments, to have that seat next to them is the biggest privilege of my life. To help train people to do this is the biggest privilege of my life. To support my colleagues in that work, biggest privilege of my life. It is a difficult journey, but it is also quite amazing. And like I've said before, it can be both those things. And I hope that people who feel that connection to this kind of work absolutely pursue it, because that's what we need. We need those people who have that goodness in them to do this.
And Dr. Warner?
There's nothing else I would ever do other than being an ICU physician. I think it is a tremendous responsibility. The trust that you build with your patients, they tell you everything. They've never met you before. They allow you to have life and death decisions with them and their families. They trust that you're doing your best for them at all times, and we do. That's a huge responsibility, and I'm honored to have it. And also during this pandemic, I feel very lucky to be able to actually have a role where I can change the trajectory of an individual patient, or perhaps, the governmental response to this entire thing through some media influence. I think a lot of people just have to sit at home and deal with the situation and feel like they don't have any power, and that must be even harder. So I feel very, very fortunate to be in the position that I'm in, and I would encourage anyone who thinks medicine is for them to continue on that journey.
Dr. Warner, Dr. Dev, it's been such a privilege to speak to both of you. We know you're very busy, and we appreciate you making the time for us. And thank you so much for your insight. It's been an absolute pleasure. Take good care.
You too. Be well.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.